Hi, my name is Marcia and I'm a professional nurse. I've been a nurse for almost 7 years. My job can be really stressful sometimes. One of the biggest hazards we face as nurses is repetitive stress injury from popping thousands of pills per month from blister packs. While not an inherently difficult task, the repeated motion can cause a variety of aches and pains and can result in more severe issues such as carpal tunnel syndrome. With remote packaging, our nurses are reporting at the end of the day that they feel much better physically than they did when we used blister packs. One of the most time-consuming parts of the job is passing pills. Med passes can be very repetitive, as you have to do them 3 or 4 times a day, every day of the year. Remote dispensing definitely makes this task a lot more efficient because you're not spending as much of your time of the day focusing on med pass, where you can definitely spend more of your day focusing on patient care, which is why we're nurses in the first place. This remote dispensing packaging technology has definitely made this process a much more enjoyable and rewarding part of my job. So the process of preparing and completing MedPass is very time consuming. From start to finish, that could take around 3 or 4 hours, which as a nurse, you don't have 3 or 4 hours to dedicate just to passing medications. And once we were up and running with the remote packaging system, we can complete a med pass in around an hour. My job can be very overwhelming sometimes. Because we're licensed professionals, nurses have personal liability concerns. There's always a chance that we could be liable in the case of the wrong medication or wrong dose being administered. On top of that, if controlled substances are missing, nurses are always the first to be accountable. Using remote packaging, I'm much more confident that the right medication is getting to the right patient in the correct dosage. With those benefits, the burden of concern is greatly reduced. Thank you for listening. Now that we talked about my problems and how they were addressed, ask yourself if you experienced those same issues. Please take a few moments to look at the supplemental material.